Hi everyone, welcome to my YouTube channel. Hope you guys are doing great today. I got more information to share about Covid-19 vaccine rollout plan in Grenada. While other countries are planning now to deliver Covid-19 vaccines, in order to enjoy a faster recovery from both the health and economic impacts of the pandemic, Grenada is not left behind. Given global demand, it is inevitable that the eventual supply of Covid-19 vaccines, currently in development in a dozen or so countries, will not be sufficient. But once they do become available, there will be a massive global effort to get the vaccines to all countries and territories. As scientists continue to work at great speed to develop safe and effective vaccines, countries must also strengthen their capacity to distribute and administer them as quickly and efficiently as possible. There are a number of actions countries can take now to make sure they are prepared to prioritize, introduce, and deliver Covid-19 vaccines. 1. Adopt a whole-of-government approach to improve vaccine delivery planning. Every aspect of the Covid-19 response, from the development of test kits to the designation of treatment facilities, has involved partnerships across society. 2. Identify context-specific vaccine delivery resource requirements. It is likely that many of the challenges that low- and middle-income countries already face related to health systems, settings, facilities, and human resources will be amplified by the introduction of the Covid-19 vaccine. 3. Agree on the vaccine priority line. The question of who should receive the first doses of the vaccine is complex. For example, frontline workers are often at the top of proposed priority lists. 4. Strengthen vaccination infrastructure. Virtually every country in the world will have to strengthen and expand their existing vaccination infrastructure in order to be able to transport, track, store, and administer Covid-19 vaccines. 5. Develop a vaccine delivery/execution plan. Once vaccines are secured by a country, they will need to be distributed broadly, including to rural, hard-to-reach, and urban areas. 6. Develop communication strategies to improve vaccine uptake. At the start of the pandemic, a parallel Covid-19 infodemic emerged, making it difficult for people around the world to find reliable guidance about transmission of, and protection from the virus. 7. Ensure appropriate vaccine reporting, monitoring, and evaluation. Given how scarce Covid-19 vaccines are likely to be at the beginning, managing and monitoring supplies will be paramount. As countries in the Caribbean region, like the rest of the world, wait for one or more Covid-19 vaccines to be successfully developed and approved, there are a number of immediate actions that they can take to accelerate the national response to the pandemic. By preparing now to implement widespread vaccination, Grenada is well positioning herself to enjoy faster recovery from both the health and economic impacts of Covid-19. Let's see how prepared we are. Dr. Francis Martin, Acting Permanent Secretary in the Ministry of Health, disclosed that Grenada has identified its priority group for the Covid-19 vaccine and has applied for early delivery. Health officials are currently preparing a rollout plan for the vaccine recommended for use in this region. Our broad-based priority group will be healthcare providers, but we are yet to decide which profession within the priority group will the first, second, or third batch that will be vaccinated. Everyone in healthcare has an important role, but all will not be able to get it together, said Dr. Martin, who previously served as the Chief Medical Officer. Through the COVAX facility, Grenada is among the list of International Development Association (IDA) eligible countries that will receive free vaccine. IDA is the part of the World Bank that helps the world's poorest countries. Whichever vaccine is recommended is set to be available in March/April 2021, but some countries in the region have made an advance application for early deliveries which might be available in February 2021. We are among the countries that have made an advance application, and so, we stand a better chance of getting our first shipment earlier, Dr. Martin said. The Gavi COVAX facility forms a key part of the COVAX pillar of the Access to the Covid-19 Tools Accelerator, a global collaboration to accelerate the development, production, and equitable access to Covid-19 tests, treatments, and vaccines. COVAX is co-led by Gavi, the Coalition for Epidemic Preparedness Innovations, and the World Health Organization, WHO, working in partnership with developed and developing countries' vaccine manufacturers. Dr. Carissa Etienne, director of PAHO, Pan American Health Organization, said on Wednesday that her organization is hopeful that the COVID-19 vaccines that will soon come to market will help contain the pandemic, but this will take time and advanced planning. While a number of vaccine candidates are under consideration, no vaccines have been approved for our region yet, Dr. Etienne said in the weekly Wednesday news conference held virtually for journalists across the Americas. We are working hard to ensure that once vaccines are approved and are available, countries are prepared to roll them out. The World Health Organization has developed a readiness assessment tool that PAHO has adapted for our region to ensure that our member states have the guidance that they need on everything. The assessment tool provides guidelines for an approach that ranges from engaging healthcare staff to regulatory aspects, communication, resources, and as well as the training needed to prepare health systems for vaccination campaigns. Dr. Martin confirmed that Grenada's rollout plan already has a communications strategy that will educate nationals about the benefits of vaccinations for medical ailments, and the role vaccines have played in saving lives and turning around economies that are affected by pandemics such as COVID-19. Dr. Etienne said that in the early days of vaccine availability there will not be enough vaccines to protect everyone, so the objective is to save lives, using the first deployment to reach those most vulnerable to develop severe forms of COVID-19 because of pre-existing conditions such as cancer, respiratory problems and diabetes. Each country must identify priority groups and adapt to communications campaign materials to meet their needs. Dr. Etienne, who confirmed that PAHO will be supporting member states in developing national health development plans. This week PAHO is convening a meeting of member states in an extraordinary session of its council, where they will meet with the ministers of health within the region to discuss the preparation for vaccine rollout and the purchasing and distribution of COVID-19 vaccines in the region through PAHO's revolving fund and through the COVAX facility. Thank you so much for watching this video. Never miss a video post by subscribing to this channel and turning on your post notification. Get updates on development in Grenada. Share this video to your friends and loved ones. Sharing is caring. Joe.